Hello and welcome to Wellness Watch, a special show curated to ensure a healthy you. A show that explores the health challenges and ailments that affect people irrespective of nationalities or ethnicity. But the catch here is to acquaint you with the wide array of possible treatments and medical procedures India offers for these ailments. Reliable, cost-effective treatments of international standard in India is not a distant dream now. So let's embark on this medical journey with me each week. I'm your host, Preeti. Our lungs play an important role in keeping us healthy and well. The fact is, like the rest of our body, our lungs need daily care and attention. Simple things like keeping active, watching your posture and staying hydrated can help keep these vital organs in good condition. However, just like the rest of our body, our lungs also age. It is absolutely important to be aware of the subtle symptoms that our lungs are not functioning as they were earlier. Our lungs are greatly impacted by the air we breathe in. By gauging the symptoms early on, we can better maintain the health of our respiratory system and also take the appropriate action to enhance its performance. There are many indicators that warn that our lungs may be aging faster than us. Today in Wellness Watch, we discuss pulmonology, the branch of medicine concerned with the diagnosis and treatment of disorders of the lungs. It is that time of the year when festivities and celebrations are galore in the air. But the same air is also burdened with the perilous air pollution, something that has become a recurring phenomena each year. Now, according to the World Health Organization, air pollution continues to be a major public health concern affecting 9 out of 10 individuals living in urban areas worldwide. Exposure to outdoor air pollution is the 9th leading risk factor for mortality, and outdoor air pollution is responsible for 3.2 million deaths each year. Don't be surprised if I tell you that household air pollution is an equal menace as is ambient air pollution or outdoor air pollution. The WHO says that lung and bronchial diseases are leading health issues in modern society. While elderly population is more at a risk of pulmonary concerns, prolonged exposure to air pollution exposes children to an increased risk of developing asthma. Asthma, collapse of part or all of the lung, swelling and inflammation in the main passage, COPD, lung infection or pneumonia are some common lung concerns. Today in Wellness Watch, we ask some very prominent questions. What are the various lung diseases? What are the warning signs of lung diseases? What preventive care should be taken? What special care has to be taken in different age groups? And we'll also discuss the treatment options available in India. Air pollution levels are spiking around the world, and with it, serious health concerns are also rising. The effects are being felt not just by those with respiratory conditions, but by everyone, children, the elderly, and even the healthy adults. We also dive into the health impact of this pollution crisis and what you can do to protect yourself.
In recent days, pollution levels have surged dramatically. The air is thick with haze as increased particulate matter and other harmful pollutants fill the atmosphere. This surge in pollution has become a major public health issue, affecting everyone's well being. As pollution levels soar, respiratory illnesses and allergies are on the rise, even in individuals who have never had breathing issues before. Doctors are reporting more cases of respiratory problems linked to high pollution exposure, with symptoms like cough, sore throat, and shortness of breath affecting people of all ages. The air pollution we're seeing has direct and immediate effects on our health. When we breathe in this polluted air, toxic particles and gases enter our lungs along with oxygen, impacting the respiratory system. Health experts say that long term exposure could lead to more severe health issues, including heart disease, respiratory infections, and even cancer. Health experts warn that children, the elderly, pregnant women, and individuals with pre existing respiratory conditions are especially at risk. Extended exposure to high pollution levels could have long term consequences from developmental issues in children to aggravated heart conditions in adults. To combat the harmful effects of pollution, efforts are underway to reduce pollution sources and keep the environment clean. But experts say this requires collective action from both individuals and authorities to make a real impact. Until significant changes are made, experts advise taking extra precautions. They urge everyone to stay alert for symptoms such as a persistent cough, sore throat, chest heaviness, difficulty in breathing, eye irritation, and unusual fatigue. Recognizing these early signs is crucial to prevent worsening conditions if you or someone you know is experiencing these symptoms. Consulting a healthcare professional is essential. Staying cautious is essential as pollution continues to threaten our health. For those experiencing symptoms, early action and seeking medical advice could make all the difference. Harshita Oberoy's report, Wellness Watch for DD India.
India has gained a stellar reputation over the past decade for providing high quality medical services at affordable costs, attracting patients from around the globe. Advanced interventional pulmonology facilities and pulmonary testing make India a sought after medical destination among the foreign tourists. Up on your screens, we'll get to the hospitals and institutes. Department of Pulmonary Critical Care and Sleep Medicine, AIIMS, Delhi. Department of Pulmonary Medicine, PGI MER, Chandigarh. Department of Pulmonary Medicine, Maulana Azad Medical College, Delhi. And Department of Pulmonary Critical Care and Sleep Medicine, Safdarjung Hospital, Delhi. All right, to discuss more about the hazards our lungs face, we will be joining in by guests in the studio. We are joined in by Dr. Nitesh Gupta. He is Associate Professor, Department of Pulmonary Critical Care and Sleep Medicine, Safdarjung Hospital. And we are also joined in by Dr. Karan Madan, Additional Professor, Department of Pulmonary Medicine, AIIMS, Delhi. Thank you so much, both of you, for joining us on Wellness Watch this afternoon. To begin with, Dr. Madan, I would want you to put into perspective for us who is at a risk of lung diseases.
So this is very important to understand, very important question, that everyone is actually at a risk of some lung disease. Now lung disease usually can be classified as various types. There are infections, we all know that somebody can get a lung infection. Lung infection can be caught by virtually anyone. But there are some people who are at more risk of lung infection, those whose immunity is low, especially people with chronic lung diseases, extremes of age, very young children, very old, elderly, and people who smoke, those who have intense exposure to air pollution, the ones who cook on biomass smoke. So all these things increase the risk of lung infections and other things also. Otherwise, there are certain conditions in which are non-infective. They are not by infection like a virus or a bacteria. TB is an important infectious condition. For non-infectious diseases, the causes can be, the body's own tendency to generate something like an autoimmune disease, or sometimes there are also diseases which are related to environment, like exposure to pollution, exposure to, pigeon droppings,
Birds,
which can lead to birds. So, so there is a large gamut of lung diseases. There are hereditary lung diseases also, which are genetic, So I think it's important to understand that lung diseases are, very broad. It's a very broad terminology. And we think of lungs as only one part, but what we should talk is intrathoracic. This means our chest cavity. So, our chest cavity has the lungs, it has got the covering of the lungs called as pleura, it has got the chest wall. So, what essentially it means is it's a big box in our body in which various kinds of, lung diseases can happen.
All right, Dr. Madan has put it very interestingly. I would want you to elaborate, Dr. Gupta, what are the different kinds of lung diseases?
So, ma'am, as sir has said, so lung diseases can involve parts of our body. So we have large airways, which begins with from the nose till they get divided into various branches inside our lungs. Moving on to that, we have lungs, which have various subcompartments, like they have alveoli where all the gas exchange took place, wherever oxygen goes, wherever carbon dioxide comes out. Moving exterior to it, there is a pleura, which is a covering inside the chest wall. So we have diseases specifically to those fields. Then third disease adds, because heart and lung are combined. They are not alone. They work in synchrony for the body to work well. So there are diseases of heart which gets affected because of the lung diseases, which we call as pulmonary hypertension, because they are that diseases because of the heart. So that is the reason we have this gambit of infection of pulmonary diseases which we see.
All right, Dr. Madan, what are the warning signs that you have a lung disease? Is it just when a person gets a lung disease? Is it only through the extremity, through the extreme levels one gets to himself to diagnose? Or to start with, what are the symptoms, or how do we know that we might have a lung disease?
So very important question, Preeti ji. So I think there are 5 or 6 cardinal symptoms of a lung disease. Most important symptom is a cough.
Okay.
Other thing is breathlessness, somebody is getting breathless. And other thing is wheezing, like a musical or a whistling kind of sound one can hear. Very important but a sinister symptom is hemoptysis, that is coughing out blood. So that is also an important symptom, and pain in the chest. So these are few very important symptoms of lung disease. It's very important to recognize that our body gives us signals. It is not that we get to know about lung disease at the extreme. So very early you can have some irritating cough which is not going away. You have started to feel breathless. Any single episode of blood coming out in your sputum, or your cough, or you are getting chest pain which is persistent. So whenever you get any of these symptoms, these indicate towards lung disease. And it's important to note that these symptoms may be common. This means there are various kind of compartments, as Dr. Nitesh told us, but the symptoms of those may be actually kind of similar. So if I say, if your cough has not gone away more than say 2 weeks, it's also one important thing which we say for TB testing.
Yes.
So a cough that is not going away, you've started to feel breathless, you have some blood in the sputum, you have chest pain, or you have got this, musical whistling sound which you, sometimes get during these pollution months. These may be early symptoms of lung disease.
All right, these could be early symptoms of lung disease, but then these are some symptoms which we commonly find in cities, given the levels of air pollution we are braving each day. How do we cope up with air pollution, Dr. Gupta?
So right, so coping up with air pollution first is preventing the exposure. So for that, if you do not have any necessary activity, you try to stay indoor. Once you are going outdoor, use a good quality mask, which actually prevents the air pollutant going in. The other thing is you avoid exercising at those times at which pollution levels are high. You move to indoor exercises. You do more of preventive thing like yoga. It helps you clean up your air. It helps you open up your lungs. And the other thing is you try to control your other comorbidities. Say you are a diabetic, you are a hypertensive, or you have any other disease apart from the primary lung disease. If you do not have any lung disease, pre-existing lung disease, you try to keep control over them. That is very important, because if you try lose control over them, most of them will lead to either pulmonary infections or any of those respiratory symptoms. So we need to also control our comorbidities which we are there.
All right, you've also talked of symptoms, Dr. Madan, but when is it that a person needs to see a doctor? Because symptoms like coughing, symptoms like breathlessness, given the circumstances, the circumstances with which we are living in the cities, and also the stress and the fast-paced lives, put all this together, getting rid of a cough is easy. You take a cough syrup. Breathlessness, you can also attribute to the environment. But then, when is it the time to see a doctor?
Yeah, so very good question. So I think all of us tend to get that cough and cold which is seasonal some point of the time. Those are called as viral coughs or viral colds, which children or start getting from childhood, and that goes on throughout our life. So I think important is to differentiate when your cough and cold is not that common or a usual cough and cold, and when things are going away. So if you had a cough or cold which started after you kind of upper respiratory infection like running nose, throat pain and some fever, and then your cough usually will get okay within a week at max. So if you have a cough which is dragged on beyond 10 days, 2 weeks, which is not going away following a common cold episode, I think that would be a trigger point. But I think some symptoms are very important. If you have persistent chest pain is not a usual symptom. If you have blood coming in your cough, it is not a usual symptom. And if you have a breathlessness which is preventing your activity, you cannot go to say the washroom, or you cannot climb even a flight of stairs.
Okay.
Those are symptoms which would indicate these are not a routine symptoms which a healthy individual is likely to accept. So apart from a cough and cold symptom, other symptoms they require investigation and a doctor's consult. If your cough has dragged on for, I think, 10 days or 2 weeks, it definitely requires a consultation. And especially if you have a symptom of fever which is persistent, you are losing weight, you're not feeling generally well, I think don't ignore your symptoms and consult a doctor.
To what extent do weather changes have a bearing on these lung symptoms? Extreme weather, for that matter, do they affect our lungs somehow?
Yeah, so I think weather is also an important a factor, and I think we see some diseases which manifest especially during weather change. One of that would be asthma. Asthmatic episodes are likely very seasonal in many of the patients. They will say, if I talk about Delhi, during the change of season around March, April or October, November, they would tend to complain that things are getting worse. And symptoms of like influenza and flu is also sometimes very seasonal. We see these cluster of cases which happen with flu during changes of season. So I think it would not be incorrect to say that weather does have an impact on the profile of respiratory.
Weather and festivities also.
Yeah.
For our viewers who've just joined in, you're watching Wellness Watch, and today we are discussing pulmonology and also the ways to detect and diagnose the lung disorders, the lung symptoms. And also we're joined in by two guests in our studio. We're joined in by Dr. Nitesh Gupta. He's Associate Professor, Safdarjung Hospital, and we're joined in by Dr. Karan Madan. He's Additional Professor, Department of Pulmonary Medicine, AIIMS, Delhi. Dr. Gupta, I would want you to elaborate more as to what kind of preventive care is to be taken when we talk of lung symptoms and the lung disorders.
So, ma'am, for the preventive care, it begins with avoid things which harm your lungs, which we know, like smoking is one thing. Avoid occupational exposure. There are certain occupations which cause lot of exposures, and particularly they are notorious to cause lung diseases in these patients. So all personal protective equipments which are required for that occupation is to be there. Keep a healthy practices, keep healthy diet. Try to reduce your stress level. We know we live in a very fast-paced world where every message needs to be answered immediately. So try to reduce the stress levels and practice some form of exercise in a day, maybe a walk 20 minutes a day, maybe a yoga, whichever suits your timing, whichever suits your body. Just try to pick up one healthy habit and continue with the same.
All right, Dr. Madan, what kind of lifestyle changes can be made to protect our lungs, to ensure that our lungs do not age faster than us?
So I think some aging, which is natural aging, is actually expected, but I think faster aging than usual is something which one is worried about. What we are essentially looking at is actually your lungs not being able to function for the appropriate age as it should be. So I think one of the biggest factors is air pollution. So how do you minimize the particulate matter exposure into your lungs is very important. So I think one thing one can do is smoking avoidance is very important. Then there is a large exposure related lung disease in a lot of women which cook in the rural household areas, which is biomass cooking. It generates phenomenal amounts of smoke. So I think well ventilated kitchens, good cook stove practices. We have a big national movement of LPG replacement that has gone a long way in reducing the exposure to those women which are vulnerable, and also importantly children. Small children also get exposed. So I think that electrification and LPG campaign can have a big role in reducing the exposures. Other thing, as Dr. Nitesh nicely pointed out, was the occupational exposures. So I think there are activities like stone cutting, grinding, construction activities which are done in which there is an intense exposure to people. So I think personal protective equipment is very important. Instead of dry cutting, wet cutting should be adopted. The guidelines of CPCB, which are there to prevent exposure to other people around a construction activity, should be followed. So I think most important thing is to prevent the noxious exposure is what's one thing one can take. Other thing is, once you have extreme levels of pollution, which are very highly polluted days, avoid outdoor exertion. Maybe as was told, try to
Stay
exercise indoors.
yes.
And I think one thing is exercise. Any form of aerobic exercise would go a long way in improving your cardiorespiratory fitness, because lungs and heart are joined together. If you get keep a healthy lifestyle, do exercise, your general heart and lung exercise health will improve. And one more thing is, for vulnerable populations, you can do influenza vaccine. So our Ministry of Health and Family Welfare also has guidelines as to which are the vulnerable groups who should get a flu vaccine, because flu can be a deadly illness in vulnerable population. So elderly, comorbid conditions, pregnancy, and frontline healthcare workers. These are the groups who require the flu vaccine, because it's a preventable infectious complication. So I think these are some things which if one practices.
All right, so those were wholesome pointers. But then there is also a trend of e-cigarettes and vaping among the younger generation. To what extent are they at risk?
So they are at equal risk, as we have said. That's why government has issued the guidelines also few years back that they should be banned and not be sold enough. They are not at all safe. So saying I will not smoke but I will smoke an e-cigarette, it does not make any benefit to the recipient. They are equally harmful as compared to the cigarettes.
All right, Dr. Madan, very quickly, is it really normal, is it easy to lead a normal life with a chronic lung disease?
Yes, so I think chronic lung disease is a burden. Patients feel that difficulty in breathlessness, their quality of life is impaired, they find it difficult to walk. But I think it is possible to lead a healthy life. One very important strategy in the chronic lung disease patients who are limited because of breathlessness and cough and symptoms is pulmonary rehabilitation. So it's kind of a dedicated, tailor-made exercise for the lung disease patients. So you give them some breathing exercises which they can do at home, and there is also something called as a structured pulmonary rehabilitation training program, in which you get those chronic lung disease patients in. It's a great idea to get them into a group, do group sessions where they can have like a gym. It's like a gym for lung disease patients. So they have instruments like an upper body cycle, they have lower body cycle, they have strength training, aerobic training. So I think as we do for ourselves, we can offer pulmonary rehab to our lung disease patients, and that can help them.
All right. What medical advancements, what medical treatments are available in India for the benefit of the foreign tourists?
I think India is a one-stop shop. We've got everything. I think in the present-day world, I think we've got the central facilities. There's a big private sector. I think there is all the essential diagnostics, treatments, and facilities are available. And I think now we have a rapid uptake of diagnostic facilities across all tiers of healthcare. And so I think regarding therapeutic, and I think we have moved at a very rapid pace, I would say in the last 10 to 15 years, in which a lot of developments have come in terms of imaging modalities. You mentioned interventional pulmonology,
yes.
And also drugs, and we've got low cost drug production in India. So with times you have biosimilars. So cutting down cost, giving the equal care is, I think it's not a dream, it's a reality in India right now.
So you would add to it?
Yes, so something to what sir has said similar. So anything which happens globally can happen next day in India. So it's not whenever somebody posts on the social media that we have done this procedure, very next day, it is being done in India, both at the government sector and a large private sector. So nothing as such, we are short of nothing. We offer everything which is offered globally to the patient care, and obviously at a lower cost and lower resource utilization.
All right, so that was an important topic which we took up for discussion today. But then for the benefit of our viewers, we would also have a quick rapid fire question round for our viewers to get some myths cleared. Dr. Karan, COPD is only caused by smoking, is it so?
No, there are multiple risk factors for COPD, not just smoking, biomass, smoke exposure, as we talk environmental exposure. I think a lot of other noxious exposures can cause COPD.
All right, Dr. Gupta, asthma is a childhood illness, is it?
So asthma is actually a chronic illness, can begin in childhood, can begin in adulthood, can even start even in elderly population. The important thing, it's a chronic illness.
Okay, asthma is also, the asthma treatment for asthma is only necessary when symptoms appear. Is it so, Dr. Karan?
Yeah, so I think diagnosis of asthma obviously happens once there are symptoms, But for asthmatics, we want them to be controlled. We don't want asthma symptoms to appear. So I think important is that they continue their treatment even once they are okay, so the symptoms don't appear.
Dr. Gupta, masks are not safe for people with lung disorders?
So masks are safe for everyone. They should be used
Do they
whenever
hamper
required.
breathing?
Though they do not hamper breathing if you have used it with the correct technique and the correct mask.
Dr. Madan, breathing in talcum powder, does it somewhere affect our lungs?
So I think the asbestos contamination is some concern which usually happens. So I think the concern is of a specific kind of cancer which is called as a mesothelioma. It's a kind of something similar to a lung cancer, but it's on the lung covering. So I think asbestos exposure, I would term it that way, is a risk factor for mesothelioma.
All right. So with that, we'll end this discussion here. Thank you so much, both of you, for joining us on Wellness Watch and enlightening our viewers with regard to lung health and how important is it for us to keep our lungs healthy. Bart Millard had said that as long as there is breath in our lungs, our story is still being written. This aptly sums up how lungs are an integral part of our existence. Most people want to get healthier, but rarely do they think about protecting and maintaining the health of their lungs. Your lungs, like your heart, joints and other body parts, age with time. By adopting certain healthy habits, you can better maintain the health of your lungs and keep them working optimally even in your senior years. On that note, we end this edition of Wellness Watch. Till we meet next, take good care of yourselves. Bye-bye.